Welcome to today's episode of the Remdesivir Files, a COVID-19 Chronicle. In this episode, we are diving into the healthcare system's perspective, specifically the strain caused by COVID-19 treatments. We'll focus on the cost per hospitalization day, ICU outcomes, and how Remdesivir may impact length of stay and discharge rates. To help us explore this, we are joined by Saakshi Sharma, an expert in health economics and healthcare system analysis. Let's start by discussing the broad question. How does remdesivir factor into the overall cost per hospitalization day in COVID-19 patients?
Great question. The cost per hospitalization day is a critical metric when assessing the financial impact of COVID-19 treatments. Remdesivir has been shown to reduce the time to recovery, which in turn can influence the overall length of stay in the hospital. For many hospitals, especially those with high patient volumes, shortening the length of stay by even a few days can significantly reduce operational costs. While the drug itself does incur treatment costs, the ability to discharge patients more quickly from both regular hospital beds and ICUs potentially help elevate the financial burden. Studies have demonstrated that the early use of remdesivir when administered to patients who meet the appropriate criteria can reduce the duration of hospitalization, thus contributing to cost savings for healthcare systems.
That's an interesting perspective. Moving on to the ICU, what role does remdesivir play in ICU outcomes? Does it have any measurable effect on ICU admission rates, or is it more impactful in terms of recovery post-admission?
Remdesivir's impact on ICU outcomes can be seen in two major ways. First, when used early in the disease progression, especially in patients with moderate COVID-19, it may reduce the severity of illness and the need for ICU level care. Early clinical evidence suggested that for patients who were not critically ill, remdesivir could prevent deterioration into severe respiratory failure, thereby reducing ICU admissions. Second, for patients already in the ICU, studies have indicated that the drug might help in shortening the overall recovery time, thus potentially reducing the number of days spent in critical care. While it doesn't directly prevent the need for intensive care in every case, its role in expediting recovery can help decrease ICU congestion, allowing resources to be redistributed more effectively.
Fascinating. Now, let's focus on discharge rates. Has remdesivir been shown to affect the discharge rates, and how does this fit into the broad discussion of healthcare system efficiency during the pandemic?
Yes, remdesivir's ability to reduce the length of hospital stays has a direct influence on discharge rates. By accelerating recovery, particularly in patients with moderate to severe disease, the drug can facilitate faster recovery and early discharge as well. This is crucial in managing hospital capacity, especially during surges in COVID-19 cases. Faster discharges allow hospitals to treat a greater number of patients, improving system efficiency. Additionally, the data also suggests that the quicker recovery and reduced time to discharge don't come at the cost of patient safety. So while remdesivir comes with its own costs, the benefits of reducing length of stay and potentially improving discharge rates help offset some of the financial strain on healthcare systems that would otherwise have to manage prolonged hospitalization.
These insights show just how important the impact of a drug like remdesivir is, not just on individual patient outcomes, but also on the broader healthcare system. Finally, looking ahead, what do you think the long-term economic implications of remdesivir could be on hospital systems as we move beyond the acute phase of the pandemic?
Long term, remdesivir's economic impact will likely be influenced by its ongoing role in managing COVID-19, particularly as a treatment option for patients who experience moderate illness or are at high risk of progression. In the endemic phase, it could serve as a cost-effective therapeutic option that reduces the frequency of severe hospitalization, thus ensuring that the resources are available for the other healthcare needs. From a broader perspective, as treatment protocols evolve, hospitals may incorporate remdesivir into standard care regimen for certain patient populations. The continuing emphasis on cost effectiveness and resource utilization will likely make it a valuable part of the healthcare landscape, particularly in systems that are already under strain due to long-term COVID-19 management needs.
Thank you so much for joining us, Sakshi. It's been enlightening to explore how remdesivir impacts not only patient outcomes, but also the financial and operational aspects of healthcare systems. It's clear that the drug plays a role in both clinical recovery and systemic efficiency. That wraps up today's episode of the Remdesivir Files. Stay tuned for more episodes where we continue exploring remdesivir and its role in the global fight against COVID-19.